Hi, my name is Morgan. Welcome back to Healing the Gap. And today we're here with one of our pilot awardees to talk about her project. And can you please introduce yourself?
Absolutely. I'm Dr. Maeve MacMurdo. I'm an occupational pulmonologist over at the Cleveland Clinic. And I really spend a lot of time thinking about worker health and worker well-being, particularly as it relates to air quality, which is now the hot topic.
So I guess we'll just get right into it. Very briefly, can you give an overview of the research that you're doing right now?
Yeah, so right now, the big thing we're working on is a project with my community partner, which is HOLA Ohio. They're a great Latino advocacy organization based out of Painesville, and really looking at the kind of exposure to outdoor air pollution, particularly PM 2.5 or fine particulate matter, which is what we see in things like wildfire smoke and agricultural dust, and really how that might impact farm worker health and kind of what people think about that air pollution.
Something we were curious about is how did you get started in this field of research? What really interested you in looking at climate and how it affects farm workers and people who work outside?
But I think the reality is we all need to eat. And the food supply in America is this kind of unseen, but really, really complicated process, which when you dig into it, fundamentally relies on this group of workers who face these huge health risks. I am an occupational pulmonologist, so I deal a lot with work-related lung disease, but we often don't think about air pollution as being an occupational exposure. And I think that needs to change. Like the reality is that when you think about outdoor workers, which is mostly agricultural workers, they are exposed to the outdoor air, and what they're exposed to increasingly is a huge amount of wildfire smoke, of particulate matter, of things that can be harmful to human health. And even before that, we know that agricultural workers just have this hugely increased risk of workplace mortality. And so the two things together really, as the doctor, as a person who cares about workers, really worried me, which is kind of why I got into this field.
I think that's really insightful, really interesting. And not a lot of people really think about where our food comes from and the work that goes into producing it and getting it to a grocery store and thus getting it to our table. It's very much, like you said, like a very like behind the scenes thing. And so I know a lot of people aren't really aware of the challenges that farm workers face. And so if you could kind of talk about what are the ailments and the illnesses that farm workers are susceptible to because of their occupation.
So I think for a start, just to kind of frame things, it's really helpful to think about kind of why farm workers are so vulnerable. Because the reality is that unfortunately, farm workers are a really, really vulnerable worker group. Increasingly, we see that a lot of the farm workers who are in the United States are coming over on this guest labor program, the H-2A program, which really means that their employment is directly tied to their visa status. So if they lose their job, they don't have a visa, they've got to leave the country. And their employer controls basically their entire life. They control their housing, they control their food, they control their working conditions. And so just to start off with, you've got a group of workers who really have very limited ability to actually advocate for improved working conditions. If you come from a different country, you don't speak the language, you are not here on a visa where you can leave, and then suddenly you're in a situation where you aren't in a safe workplace, you're stuck. You basically can't do anything. And unfortunately, unlike other sort of working class in the United States, the labor rights movement and the sort of labor rights actually of farm workers are really reduced. Farm workers have been penalized for unionizing. Farm workers face a lot of backlash for trying to advocate for improved worker conditions. And so it's really a rock and a hard place situation. You need the money, you have to work. You can't really leave. You have no money to leave, but also the work you're doing may not be safe. And so kind of on that note, when we're thinking about what we actually see in terms of farm worker health, it's really the workplace exposure. So farm workers are much more likely to die on the job than the average American. They are 10 times more likely to die of heat stroke. They face a significantly increased risk of crash and fall injuries. And they also have a lot of exposures we don't think about, things like pesticides, things like air pollution. But with all of that, it's also very, very hard for farm workers to seek healthcare, both because they can't leave their farm. They're often working 6 days a week or 7 days a week. They may not have transport. And if they do have transport, they may not have health insurance. if they do have health insurance, they often don't speak English fluently and they face a lot of barriers to actually seeking healthcare, particularly outside of major farm worker centres. And so a lot of farm workers don't get screened and don't get diagnosed until after the damage is already done, after they have diabetes, after they have lung disease. Because until things get really bad, you really don't have a lot of options.
Something that I was curious about, I'm not sure if you know this, how many like migrant farm workers do we have here in Ohio? Because I think when people think of migrant farm workers, they think anything like in southern states. And I obviously Ohio is a big farm state, but a lot of people think like small farms or like Midwestern farmers. I'm not sure if you know the answer to that. It's all right if you don't, but just to like, I don't know, like educate listeners of like, who is working in the state and who's doing the producing here. Do you by chance know?
I do not have exact numbers, but I can
Mhm.
tell you that most of the farm labor in Ohio is, again, farm worker labor, not all migrant, but increasingly we are seeing a lot more of this guest worker population. And I think there's around 6,000 H2A, those guest workers in Ohio right now, but I wouldn't quote me on that.
No, but that's, yeah, I was curious because that's not like you mainly hear about like farm workers like not in Ohio, which is so weird because Ohio is a farming, very much a
Ohio's a
big
farm
farming
state.
state.
I think actually it's really hidden here. Like I'd say the Latino population in Ohio is really strong,
Mhm.
but they are much less visible, I think, than they are in places like California and Washington. And I think, particularly in Ohio, we really don't think about how much food we make here, but we do a lot. And it's not like I focus on farm workers, but it's not just farm work, farm work. A
Mhm.
lot of the food processing, a lot of the meat packing, for example, that's huge in Ohio. And most of those workers are Latino.
A different organization that we're hoping to bring on. We want to talk to them about the algae blooms that have been happening in the lake,
Hmm.
in Lake Erie, and that's very much related to like farm work and the nitrogen in the runoffs.
Yep.
And
It
so,
all goes together. Pieces. I mean, again, farm work really is a foundation for a lot of what we do in public health. Like when you think about food access, food insecurity, energy insecurity, like it all comes back to where the food comes from and how we're growing it.
mhm,
We're not always growing it in ways that are good for workers.
right. I know you kind of briefly spoke about like the challenges farm workers face for healthcare access. I was wondering if you could talk a little bit more of that, and also what organizations do we have here that help kind of bridge that disparity, like HOLA, that help farm workers in the area?
Yeah, so I think the big challenge, particularly in Ohio, is again, we aren't that big sort of agricultural center. So there are really great migrant health networks throughout the country who provide a lot of really, really valuable care to farm workers. And there are some in Ohio too. But compared to places like California and Washington or even North Carolina, we're a little bit less visible. HOLA is doing really amazing work, getting farm workers tied in with Medicaid, getting farm workers to healthcare, kind of helping with that. But I think there's definitely a lot more need for research about how we actually can make healthcare more accessible for workers overall. Because when we think about, again, farm workers are who I'm focusing on, but really workers more broadly face really unique health risks, and it can be really hard to seek healthcare when you're working a job where you can't just take a lunch break and go see a doctor.
Makes a lot of sense. And we want to hopefully get Ola on as well to talk about like their work. But given your research, what are some of the things that Ola does, like specifically in ways to connect farm workers to healthcare and overall just overall well-being and health resources?
I think the question is really what HOLA doesn't do. They are a very multifaceted organization and their staff is fantastic. Like working with them, I have learned so much about the many, many hats they wear. I think that's kind of an example of how you can be a really successful sort of small community organization is you've got to basically be able to shift hat from hat to hat to hat and be able to fill all those roles. Because when people come to you, they want to have a one-stop shop. But all does a lot with legal aid. They do a lot with, again, thinking about childcare, helping kids of farm workers get into college, because it's a really good way to, again, potentially make things more sustainable. Think about getting out of farm work and having that sort of community growth and stability. They do a lot with Medicaid. They do a lot with community health fairs. And actually, we're having a community health fair early in September to really try and get farm workers on the screening they need. Because with the research we did with Ola, one thing we found is that, farm workers had a lot of symptoms. They had a lot of shortness of breath. They had a lot of cough. There was a lot of stuff going on. Basically, no one had seen a doctor. And no one really knew whether they had any kind of underlying lung disease because they hadn't been checked for it. So we're actually going out and doing some breathing testing, and we're doing blood glucose screening because diabetes is a big problem. We're checking blood pressure and really trying to get people the services they need. But I think it's really great if, as a sort of healthcare organization, we can come to people rather than making people come to us. It makes it a lot easier.
So I was just thinking.
But I'm like bombarding you with stuff, but I am, as you can tell, passionate about this
No,
field.
as you should. No, I love when guests come on and they're just like boom, boom, boom. I'm like, please keep going.
I know my residents and my fellows know that I could go on about this for half an hour without stopping. So
That's good though. That's good. It's a very large topic. Like it's
huge. We really need
yeah.
more than just me. And I'd say, like, in terms of research needs going forward, if people are interested, like, there is so much to be done. Thinking about how we can expand blood pressure screening, thinking about cardiovascular disease and air pollution, because that's a major driver. And
Really.
then thinking about also the retiring of elderly or older farm workers and really what's going on in their lives. Because we're seeing that, again, a lot of farm workers are now getting to 45, 50 with untreated health conditions. And 50 with bad diabetes is a very different 50 than 50 with well-treated diabetes. And so thinking about kind of those unique health needs, people can't work any longer. I mean, there's so much to be done. Like, It could be 12 of me.
This, like, meeting you was the first time I had like even heard of the field of an occupational pulmonologist. And so I guess kind of delving into what's been going on in like current events, like, are you and your colleagues, what have you guys been seeing with the change in like air pollution with the Canadian fires and that kind of like traveling down here? Because that's something we're not accustomed to. Like, I have friends who live in like the Bay or like, the Pacific Northwest, and like, oh, it's so smoky today. And I was like, ah, typical. But then it came here and I was like, oh, it's this. Oh, you guys are living like this. I would have never known. So I was just kind of curious to see like what like people in your field, whether occupational pulmonologists or just general pulmonologists, what you guys have been seeing with like the uptick in like bad air quality.
I think it's really bringing people's attention to it, which is kind of, it sounds backwards, but kind of nice for me, because for a long time I've been kind of shouting into a void about air quality and, hey, it's coming and it's going to hit us soon. And it has now. And the reality is that unfortunately, this wildfire smoke season is not going to go away. We are seeing just an increase in wildfires across the board. And it's not just a West Coast problem anymore. So again, it's really a US-wide we need to think about. But we do see, again, when we have these wildfire events, people are more short of breath, people are coughing, people are wheezing. I get a lot of patients asking me kind of what they should do and what they should kind of try and avoid. And the challenge is that, particularly in Ohio, particularly in summer, it's hot. And so thinking about exposure mitigation and reducing exposure really means staying inside. But for people who live, particularly in apartment housing, who may not have central air conditioning, it can be really challenging to isolate indoors without being exposed to high levels of heat, or turning on a window AC and just pulling in PM2.5 into your living room. And so it becomes a really, really tough situation. Like, there's a lot that's going on the West Coast to try and address this, but Ohio hasn't really gotten there yet. So again, more research is needed.
Yes, definitely, especially if it's gonna start impacting more population in the US. I think that needs, because I'm assuming California has it's more of like state legislation, policy, and research in terms of like wildfire smoke.
Yeah, California, Washington, Oregon are all doing a lot of really good work on this. I think the big challenge with Cleveland is thinking about our really vulnerable populations, our children with asthma. Cleveland already has some of the worst asthma in the country. And so if we have now these air pollution events, if we have a sort of underlying issue of, really environmental injustice and structural racism and energy insecurity, all those things work together and all those things make things worse. And so it really requires a really engaged sort of community-led solution, but also research and money.
Right.
Yeah.
Right.
The two big challenges.
Have I guess, do you think after this summer, because of the events this summer, that there'll be more of a push towards like more climate change, air quality research, especially how it relates to public health, or maybe even more like policies geared in that direction?
I think it's coming. I think one big gap from my standpoint is right now there's really no occupational air pollution standard. So OSHA does not regulate exposure to outdoor air pollution, which
Wow.
is huge. Again, when you think about patients that I really am thinking about, farm workers, California and Washington have implemented sort of their local standards. So they have state level standards for air quality. But if you're outside those states, you don't really have any kind of protection. And so thinking about that is a big issue. And then the heat standard, which is hopefully going to come into effect soon, and it's just going to be big. But again, extreme heat, extreme air pollution, they go together and they're both really bad for you.
Yeah, that's what I wanted to ask, if there was any policies, particularly in Ohio or even federally, that serve to like protect farm workers or occupational workers who work outside. And it sounds like there really aren't.
There's a heat standard coming, and I think that's the big next step is the heat standard. But so far, no occupational air pollution standard. Hopefully that's going to change, but unfortunately, even once it's there, the challenge is always going to be implementation and enforcement, particularly thinking about a lot of these small farms and rural farms where, again, if the standard's not being followed, what is an individual farm worker going to do about it, and how can they actually change that for themselves?
Yeah.
OSHA needs more funding too. I was going to say, really, OSHA has been severely underfunded for a number of years. And so thinking about how we fund and how we value our workers, giving OSHA the tools to actually enforce the standards they've put in place would be really big.
I'm taking it all in because I think it is like a very new field for a lot of people to think about, like climate change and heat and air and how it impacts people's health. And I think it's like, it's something that seems so basic, like, yes, of course, like the air we breathe.
Yeah, pollution
Somehow,
is bad for you. I know it's
yeah, who would have, like, we all knew that. But I think what really stands out is the fact that there are a lot of disparities in how climate change and air pollution impact certain communities more than others, and how that also relates to like who has a seat at the table.
Mhm.
Like the people it impacts the most are not the ones who are able to like offer up like how it's impacting them, or just like have their voice like rightfully and proportionally represented in like these conversations.
Exactly. Like the reality is that I think for a long time we've sort of said, the air quality is getting better. We're making things better. Things are heading in the right direction. And what we really not pay as much attention to, that this is changing, is that, again, communities who already face disparities, communities who have faced historic redlining, for example, have not had that same benefit. The air quality has improved, but has not improved equally. And really now we see those long-term health impacts of that. And it really starts from the minute you're born to the minute you die. Air quality drives a lot of poor health outcomes. And so thinking about that in sort of context of climate change, of other stresses, again, it's really something that we can fix. Like we can improve air quality. It's not a black box, we know what we can do. It's just doing it.
Like you just finished off saying like, there is a way that we can make this situation better. From an individual standpoint, I know oftentimes when we talk about things that need to be done to better our climate, better our air quality, it's we talk about it from, there needs to be work from very high level institutions or like corporations.
Mhm.
And sometimes that leaves an individual feeling very like lost of like, well, what do I do? I'm just a person who lives in Cleveland, Ohio, doing X, Y, Z. So I guess what are your kind of from your would you have any wisdom for an individual who wants to either who is invested in air quality and climate change, things that they can do personally to better either their own health or their family's health in times where we are seeing days when we're getting up to like, the air quality index like up to like 160s and plus?
So it's kind of two factors here. I think, one really frustrating thing about climate change and inequality is, like, you're right, it does come down to policy and really big companies, big things making change. But a lot of that change really starts at the local level. And so getting engaged in your community, in local city council meetings, that's where a lot of the policies actually move forward. again, Cleveland is actually in a really good position right now to improve our air quality and to actually really expand. We've got a city council who wants to do this work. The local air quality EPA got a grant to expand PM2.5 monitoring historically redlined areas, which is huge. So we're getting better, we're doing things. But the more people are engaged at that local level, the more things actually happen. And it's a lot easier to get policy passed locally, then move it up, than it's to start big and move down. So change can happen from the ground up. I think that's where change has to happen. In terms of kind of jumping back to, say you have a pure air quality day and you're worried about your own health, it's a little bit tough. There is some data about air purifiers, and they can be effective in reducing the concentration of air pollution in the house. They can be expensive to run sometimes. Again, it's an outlet which requires power, but they can be effective. If you have to go outside, really it's about thinking about what you're doing and planning your day around the air quality. So trying to avoid doing really physically strenuous tasks in periods where the air quality is poor, walking, not running, if you can, not being outside. And then also just really watching the air quality and looking at how that impacts your health, because you can make a lot of decisions based on what the AQI is going to be and try and avoid some of those really high level exposures, like kind of during rush hour, for example.
I never thought of rush hour as a
Rush hour, yeah.
time.
Rush hour is bad.
Wow. That makes a lot of sense
Yeah.
because everyone's out driving. Okay, thank you so much. This was so cool. This is very interesting, very engaging. And thank you for the advice at the end. I feel like a lot of conversations about air quality, climate change really make people anxious and can really like put you in a mood of like helplessness and hopelessness. And I think a lot of conversations need to have that like equal, that balance of, yes, we are at a turning point. There's a lot that needs to be done, but also like seeing that, there is a way that we can, better our climate, better our earth, and having some positivity and optimism towards it and being very like solution oriented. So
things can get better, but I think it really needs to come from local level, and really communities know communities know their community, not to be cliche, but people know where they live and people know where the problems are. So using that knowledge and actually expanding on that really has a lot of value.
Right. People know what they need. You gotta listen to them when they say it.
It turns out lifting's kind of hard sometimes, but it really is the most important thing.
Great. Thank you so much for coming to talk to us today. This was very great.
This was fun. Thanks for having me.
Oh, of course. This was so cool.